Hi, my name is Marcelo Rosa de Rezende from the Brazilian Hospital in São Paulo, Brazil, the faculty of University of São Paulo, Brazil. Today I'm going to talk about the anatomical study of metacarpal arteries, and I'm intend to show some clinical case. We did an anatomical study of the metacarpal arteries. This is our dissection. We used dye solution. We injected on the radial artery, and here we can see the radial artery here and the dorsal arc. That the dorsal arc from this arc come the second, the third, and the fourth metacarpal artery. I would like to remind you of you that the first metacarpal artery comes from the radial artery. It's a direct branch from the radial artery. We dissected 26 cadavers, 26 hands. We injected the dye solution at the radial artery. In this study, we studied the anatomy of their metacarpal artery, their location, possible anastomosis, the proximal and distal one, and the presence of the cutaneous branch. Here we can see the emergency of the first metacarpal artery. It comes from the radial artery. We are going to show in details in the coming slides. The right side, we can see an overview when we have the radial artery and the three branches, the distal three branches that we are going to talk later. And here the dorsal arc, and from this arc, the dorsal one, comes the second, the third, and the fourth metacarpal. This is a detail in the proximal metacarpal. We have the second metacarpal, the third one, and the second metacarpal artery. In the proximal base of the metacarpal, we can see the proximal anastomosis. Here is the branch that comes from the dorsal arc and is going to form the second metacarpal artery. Here we have the pattern, or arterial pattern of the second metacarpal artery. Usually it comes from the dorsal arc, like in this case. But we found a different situation when the second metacarpal, like in this case, it came straight from the radial artery. Is an exception, but it could happen in this way. And from this second metacarpal comes the dorsal arc that's going to form the third and the fourth arc, the metacarpal artery. The pattern of the third metacarpal artery we study here. We can see the proximal anastomosis. This branch comes to the proximal area between the third and the fourth metacarpal. Here is a detail of the proximal anastomosis of the fourth metacarpal artery. This is a design of the dorsal metacarpal artery. When we plan based only in the distal branch, the cutaneous branch, like a perforance vessels that comes from the metacarpal artery. If you keep intact the metacarpal artery, we call this flap based on this cutaneous branch as an anterograde flap. But if we do a ligature of the proximal metacarpal artery, we call that this flap it's retrograde is in a retrograde fashion, based not only on the distal cutaneous branch, but also in the small branch coming along the flap. This is the detail of the perforance branch that comes from the second, third, and fourth, goes to the cutaneous area, and is going to be the base of the metacarpal flap in an anterograde fashion. Here is a schematic representation of the proximal and the distal anastomosis between the dorsal system, the metacarpal arteries, with the volar system, the arterial system, described by Dotel and Merli. Here is a representation of the proximal anastomosis of the second metacarpal artery and the distal anastomosis, distal anastomosis between the second metacarpal artery and the palmar system. Here we dissected in a separate fashion the radial artery here and the dorsal branch. From this dorsal branch comes the second metacarpal artery. Here, following the radial artery, we can see the three branches. One, it's the pollicis princeps, the princess branch, go to the thumb, and the other branch is the first metacarpal artery that comes straight from the radial artery, and the third branch is the branch that is going to compound the deep branch, arterial branch, the palmar fascia, palmar aspect of the hand. Our results are that the arterial metacarpal system is a reliable one. We could see the communication of the dorsal with the palmar arterial system. We could, it's reliable also the presence of the cutaneous branch distally. The first and the second metacarpal could be identified in all cases, but there are a variable frequency of the presence of the third and the fourth arterial metacarpal arteries. Here's the pattern that the anterograde flap. Here we can see in a dissected hand when we put some dye solution in the artery, so you can see the cutaneous branch very well here. This is a schematic view to how to design the dorsal metacarpal flap in anterograde fashion. Here the flap was dissected and based only on the cutaneous branch, so we can rotate it about 108 degrees. Here we did the flap is a schematic view to cover a distal portion of the finger, so we could use the flap based on the second metacarpal, but in a retrograde fashion. We ligated the second metacarpal proximally, and then we rotate and keep not only the cutaneous branch, but also the small branch that comes from the proximal part of the flap. The flap was rotated, and then we have the other flap that's based on the first metacarpal artery. It's known flap as Kite Flap, based not only on the first metacarpal artery, but you can take a branch of the sensitive branch of the radial nerve, so it's a sensitive flap. It's especially to indication is to cover the volar aspect of the thumb. Here is an example. We have a open injury at the dorsal aspect of the third metacarpal, the metacarpal phalangeal joint, exposure of the tendon, the joint. So we had to put a flap. So we planned the second metacarpal artery flap based done in a retrograde fashion. So we plan here the flap. We ligate the proximal, the second metacarpal, and rotate it. Here's the results, the long follow-up. Here it's an open injury with exposure of the tendon, the joint, at the radial side of the fourth finger. So we planned the flap based on the third metacarpal artery. So in anterograde fashion. This is the immediate postoperative view and the long follow-up of this patient. Good range of motion, a good aesthetic result. Here is the burn injury at the dorsal aspect with exposure of the second finger, with exposure of the tendon and the joint, also the IP joint. So we planned the second metacarpal flap, anterograde flap, based only on the cutaneous branch distally, that is located about 1 millimeter proximal to the metacarpal phalangeal joint. Here is the long follow-up of this patient. Here we can see fracture, articular fracture of the IP joint. So we can see the fracture, exposure, laceration of this tensor tendon, and then the flap was rotated. Here the fracture was reduced and fixated. Here is the end result. Here we have exposure of the volar aspect of the thumb and the pulp area. So we plan to use the kite way flap, so we can include some sensitive branch of the radial nerve to give sensation of this area. So here is the flap. Here's the touch in the very good shape, and including the sensibility of this area. This is a squamous tumor, spinocellular tumor at the dorsal of the third finger. So we did a resection, and then we planned a second metacarpal flap based in a retrograde fashion. This is the immediate follow-up and the long follow-up. This is a different situation. We have exposure of the tendon and of the third finger at the volar aspect. So we plan to use the second metacarpal flap in an anterograde flap, when is based only on the cutaneous branch. So we rotated this flap, and then we could cover the area in the volar aspect, crossing the web space. So this presentation, I tried to show the association of the anatomy of the metacarpal arteries, and the importance of to know this anatomy to apply for clinical case, specifically in the metacarpal flaps. Metacarpal flaps can be done in anterograde fashion or retrograde fashion. In case of the first metacarpal, we can include a sensitive branch to give sensibility to this flap. So it's a very important topic, especially if you are considering coverage, especially at the dorsal part of the fingers. Thank you very much.